As Singapore's COVID cases continue to rise, the country's health ministry said that it strongly encourages people to wear a face mask even if they are not ill, particularly in crowded places or when visiting vulnerable people. Singapore Health Ministry said on December 15th that the estimated number of COVID cases increased to 56,043 between December 3rd to 9th, a whopping 75% jump as compared with 32,035 cases in the previous week. Lead India correspondent Andrew Wood joins us from Macau for more on the record COVID cases in Singapore. Andrew, good morning. Do we know more about what's behind this surge?
Well, the scientists and the doctors in Singapore say that most of the cases are of a sublineage of COVID, BA2.86. In particular, the sublineage is the JN.1. Now, the scientists say that there's no reason to suspect at the moment that this particular sublineage is more transmissible. In other words, it's easier for people to give COVID to each other, that this sublineage is any more transmissible than any other varieties of COVID. But it is still rather an arresting, enormous jump in the number of cases, as you say, from about 32,000 to about 56,000. The Singaporean authorities are opening a special facility in a big exhibition hall near the airport. The number of people in intensive care as a result of COVID has risen, but it's a very small number. It's only gone up from something like 4 cases to 9 cases at the moment.
All right, Andrew, also let us know what are specific areas of public life which the government advisory covers.
Well, masks are back. I mean, in some cases, in some respects in Asia, masks never really went away because a lot of people continued to wear them after COVID, either to protect people from normal colds and flus or because they were worried about what might happen, whether there'd be a resurgence of COVID. But basically, it seems that if you're a minor case, you can probably be diagnosed by your local primary care doctor, or you need to sort of talk to the Ministry of Health if you have a more serious case.
All right, Andrew, a quick word on the severity of this variant, because you tell us that though masks are back and scientists are still are not very sure about how serious or for that matter how grave is the situation in Singapore. Can we get more details on the transmissibility of this variant and what is the severity of this variant?
Well, at the moment, as they say, the doctors and the scientists say there are no grounds to believe that this particular variant is any more transmissible than other variants. And they're looking for a reason why there's been this sudden surge in cases. It could probably be, I mean, one possibility is just because as all of the restrictions, the measures that people had been taking, people were on the whole thinking that COVID was over, that there was no need, governments and people thinking there's no need to take extra precautions anymore. And so it's suddenly come from nowhere.
All right, Andrew, we leave it here. Thank you for joining in with those details.